Now a 12 News exclusive, C-section concerns. It's major abdominal surgery, but it's increasingly more common, and now local health officials are trying to reduce how often it's performed.
According to data we obtained, about 1/3 of Rhode Island babies were delivered via cesarean last year. Experts say it's too many. 12 News reporter Kim Kalunian went to find out why this surgery is on the rise and what the impact is on mothers. She joins us now with what she's learned. Kim?
Well, Shannon and Mike, a Brown and Harvard-educated OB/GYN who tracks C-section data, tells me a healthy 18-year-old woman is twice as likely to have a C-section now in 2023 than the year she was born. He says the way we've given birth has changed a lot over the last generation, and not necessarily for the better. 5-month-old Jack came into this world the way hundreds of Rhode Island babies do each year, an unplanned C-section.
When they said that that was really our best option, I cried.
His mom, Nora Crowley, was unexpectedly induced after doctors raised concerns about Jack's heart rate during a routine checkup. 10 hours later, Nora's doctors told her she'd need to have surgery.
You have nothing to go on aside from trusting that your doctor's offering you their best recommendation, and so the only path forward really is to say yes and agree.
Within minutes, Nora was whisked into the OR. She said it was bright and loud and left her with lingering physical and psychological pain.
There were some nights early on when I thought about going back to the emergency room because I thought something must be wrong.
Across the country, overall C-section rates are up, and in Rhode Island, low-risk C-sections are on the rise too. According to health officials, a low-risk C-section is one performed on a first-time mom with a single baby that's full-term and head down. According to data from the Department of Health, Rhode Island's low-risk C-section rates are higher than the region and national average, rising from about 25% in 2017 to just over 30% in 2022.
Those are high numbers.
Dr. Neil Shah trained at Brown University in Women and Infants and has spent much of his career studying C-section data. He says the major abdominal surgery exponentially increases the risks for hemorrhage or infection.
A first-time C-section is a pretty straightforward surgery, but the second or third or fourth time even, it can get pretty complicated. There is real morbidity and real harm to doing too many C-sections.
Shah says in 1970, the U.S. C-section rate was just 5%. Fast forward 53 years and it's gone up 500%. This despite the fact that his research shows fewer than 0.5% of women elect to have C-sections. So what accounts for the increase? He says it's not because moms are more obese or older, IVF, or even the higher reimbursement rate for surgery. Instead, he says when you surround women with surgeons, they're more likely to have an operation.
You're always blamed for not doing the C-section. You're rarely blamed for actually doing the C-section.
Is it possible that providers are pulling the trigger on C-sections a little bit sooner in order to, frankly, get a labor and delivery room back open and have that mom and baby be moved along in the process a little bit faster?
100% yes. In fact, that's probably the biggest explanation for the variation in C-section rates by hospital and the changes over time. The hard thing is to persist. The easy thing is always to go to the operating room. And we actually have data showing that the busier a labor floor is, the more likely it is for a C-section to happen.
Shah says any harms done to a mom and baby are much more obvious when a C-section isn't performed. Crowley and her baby are healthy, two facts she's focusing on as she continues her physical and mental recovery.
When doctors are recommending that C-section be the path forward, recognizing that it's not routine for the patient. It might be an easy hour for the doctor, but it's not at all for the parent in front of them.
And having one C-section increases the chances you'll have another, which further drives up the overall rate. Coming up new at 6, we'll tell you which Rhode Island birthing centers had the highest rates of low-risk C-sections last year and what health officials are doing to get those numbers back down. Live in studio, I'm Kim Kalunian, 12 News.
Now at 6, more of our 12 News exclusive C-section concerns.
The thing is, in healthcare, you can hurt people when you do too little too late and when you do too much too soon.
At 5, we told you Rhode Island's rate of low-risk C-section is higher than the region and the country, and the major abdominal surgery increases the risk of complications and death for mothers.
And new at 6, we've learned health officials are working to get those rates down.
12 News anchor Kim Kalunian spoke with experts and a local mom. She joins us now live in studio with the data and what this means for local families. Kim?
Well, Mike and Shannon, while C-sections can potentially be life-saving, experts say hundreds of thousands of people across the country may be having them unnecessarily. But what is the ideal C-section rate? Doctors say it's not zero, but it's also not what we're seeing in Rhode Island.
Are you going to smile for the camera? No, he's not going to.
When Nora Crowley's doctors told her a C-section was her best path forward, she felt like something was wrong with her.
I think that's partly why I burst into tears in the labor and delivery room when they said C-section was the only option.
5 months later, baby Jack is healthy, but Crowley is still recovering from the physical and emotional toll of the surgery.
I have been working through that feeling of that my body or I couldn't do what it was supposed to do. That's been a hard part of the recovery.
In Rhode Island, roughly a third of babies born last year were brought into the world the way Jack was, and experts say that's too many C-sections.
There are absolutely reasons why we need to do that, why a mom's health or a baby's health could be in jeopardy, and in that case, it's important to do so. But there are low-risk women.
Elizabeth Roshan leads an organization that's in part focused on reducing low-risk cesarean rates in Rhode Island to 23.6% by the year 2030. Currently, no Rhode Island birthing centers are at or below that benchmark. Last year, according to data from the Rhode Island Department of Health, the overall rate of low-risk C-sections was 30.2%. Broken down by birthing center, Landmark Medical Center in Woonsocket had the highest rate, over 35%, followed in turn by Women and Infants, South County, Kent County, and Newport hospitals. The health department says there are a lot of factors that contribute to these numbers, many of them beyond the control of the specific facility.
We undersupport people to just go through the laboring process.
Dr. Neil Shah trained at Brown University and Women and Infants and has spent much of his career studying C-section data. He says surrounding women with surgeons has led to more potentially unnecessary surgery.
The difference between 21 and 22%, I don't know if that really matters, but the difference between 20% and 30% really, really matters, right? Across the country, that is potentially hundreds of thousands of people that are getting surgery that don't need it. And in fact, I would go as far as to say that the decision to do a C-section is the largest and most consequential surgical error in the world based on how often we get it wrong.
A cesarean birth is major abdominal surgery.
Roshan and Shah say doulas, midwives, empowering patients, and investing in maternal health could all be part of the solution. Crowley says more support for moms post-cesarean is critical.
If we're not making sure that people are getting access to that kind of support, I think having those numbers go higher is a scary prospect for sure.
And the U.S. has also seen an increase in maternal mortality. According to the CDC, in 2021, the number of women who died during or shortly after pregnancy hit its highest rate since 1965. It's an issue that disproportionately impacts women of color and a problem that plagues America more than any other high-income country. Live in studio, I'm Kim Kalunian, 12 News.